It is like
Good morning, all of you. A warm welcome to all of you on this special occasion where we are celebrating a journey of 500 cochlear implants with Dr. Sumit Mrik and his team at Max Healthcare. Myself, Poonam, Senior Audiologist working with Amplifone India Private Limited at SANKALP ENT and CI Center. For the last 5 years, I take care of the entire audiology diagnostics and especially evaluating all the deaf children at the clinic. To address this welcome note, I would now like to welcome Dr. Mridu Kaushik, Senior Director, Operations and Planning and Chief Operating Officer, Cluster 1, on the stage, please.
Good morning, everybody, and what a pleasant day it is for actually being here. When Dr. Sumit asked me, will you be available on Saturday at 11 a.m. and he says we are very punctual. And my schedule is something which I cannot predict with any certainty. Where will I be? But I promised that I will be here at 11 a.m. And he called me at exactly 11 a.m. sharp. Where are you? I said I'm 30 seconds away. All this was possible because of many. One technology, we could connect the waves that were traveling through the air to these walls. More importantly, he was able to speak and I was able to hear. If I was not able to hear, I would not have understood what he wanted to say, or even if I've understood, I may not have been able to communicate what I wanted to say. The hearing precedes speech, precedes everything. It's not just hearing, it's listening. Listening comes a little later. But it's an honor for all of us to host you all here, to have you here amongst us. You were not, I think, I'm not able to guess the right word, get the right word. Honor is a very small word. We are actually very grateful that we could do this. We are very humbly we state this. If we were able to help some of these kids, we find ourselves fortunate enough. And Dr. Sumit, I must congratulate you for this opportunity, especially to me. I have a sister who could not get this done. She had been in this situation for almost 49 years, younger one to me. We didn't know this existed at those times, and even if it existed, whether we were able to afford this, the agony, the pain, the issues that we face, and the mental trauma that she had undergone the last 49 years of her existence, I think it cannot be described. Again, Dr. Mrik, thank you for these 500, helping these 500 souls. God is watching, sir. And in more than one way, He returns the favors. I think He will give you strength to provide assistance to maybe 5,000, 10,000, 20,000 people. And may God reduce this burden Himself so that we are not required at all. Thank you very much. Thanks a lot.
I now request Mohammed Akbar, cochlear implantee, to hand over the token of thanks to Dr. Mridu.
So Mohammed Akbar Khan is one of the implantees who was earlier implanted with the help of Max India Foundation. So he is very special to us, and when he goes to college, he can communicate very well, and he's an independent child. He's from a village close to Hapur. And when he came to us, he had lost hopes from everywhere. He had been to every hospital. Then Dalbir Singh was in charge for the Max Foundation. We approached her, and with the help of Dr. Gurpreet, Dalbir Singh, we got her implant done, and his implant done, and he's absolutely fine. He will share his journey sometime.
Thank you, Dr. Mridul, for beautiful words. I now request Dr. Sumit Mrit, Associate Director and Head ENT, to address his introduction to cochlear implant program accomplishments at Max Smart.
Thank you, Poonam. What a day. 17 years of journey has culminated into a day which I am standing so grateful and thankful to God. Thanks to Max Healthcare, I have been working hard, but I think the way we changed life has changed with the way the vision of Max and mine matches. Thanks to Dr. Mridul, Dr. Sandeep Budhiraja present here, Anas sir, my teacher, my guru, Dr. A.K. Agarwal. I cannot be more fortunate at the journey which I started in 2004 when I joined as a postgraduate at Maulana Azad Medical College, and destiny had planned something that I landed in Sir's unit. I was not supposed to land, but then I landed in his unit, and from there we started the journey. Welcome to Dr. P.S. Bhandari. Sir has been, I was known to like a plastic resident, but fortunately destiny was somewhere inside the cochlea. Welcome Dr. Gurpreet sir, Dr. G.K. Mani, Dr. Manju Mani, blessings from you. So these are some of the lovely faces. I couldn't fit everyone, but 500 implants from everywhere, from about patients from about 19 countries in the world. We are live on YouTube through one of our trust channels in 26 countries in the world. We are live through Zoom. Patients from all across India, Pakistan, Nepal, Bhutan, Bangladesh, Sri Lanka, so many countries, Afghanistan. They are with us from Kenya, Rwanda, Burkina Faso. Then they are watching us live. So how the journey started? Now this great man standing in the center, which you can see right here, sitting in the front row on the first seat, my teacher Dr. Arun Kumar Agarwal, that time Dean Maulana Azad, Medical Superintendent MMC, Head of Department ENT. So when I joined his unit, and his passion was otology, and I was supposed to do something in otology, but in the first month of my post-graduation, I decided to leave ENT because I never wanted to be an ENT surgeon. I wanted to be a plastic surgeon. My dream was to become a plastic surgeon. I hated general surgery because they were the biggest sadists in this world. So I thought I'll do ENT and I'll then do MCH plastic surgery from CMC Vellore. And that's why my thesis topic was on sensate free flaps. Dr. Bhandari was the guide, Dr. Arun Agarwal was the co-guide. But unfortunately, Dr. Agarwal, even being the dean, my topic was rejected by the ethics committee. So finally, in the end, I couldn't pick up an otology topic which was favorite for Dr. Arun Agarwal. I landed up doing a rhinology topic. So somehow I survived those 3 years. I found my love, my wife, Dr. Pooja, who is currently professor at RML. And then when I came to senior residency, I was handed over the keys, like a mother-in-law hands over the keys of temporal bone dissection lab. That now you are the sole in charge, you have to run the lab at Maulana Azad and you have to enjoy that. And this is when I ventured deep into otology, into the temporal bones, drilling, conducting so many workshops under Dr. Arun Agarwal. And this is where I found my love in cochlea. And my dream of becoming plastic surgeon went away, and this is how I went on to become as a cochlear implant surgeon. My mentors, my guru, my teacher, I would say a father figure to me. We connect even more now over cup of tea every 10-15 days when he calls me कि दोस्त तुम बहुत दिन आए नहीं मिलने, and we meet over on tea. Another person needs a lot of importance in my life is Dr. Milind Kirtane, the father of cochlear implant India in the country, and he has been my inspiration. He has been inspiration to so many people. But I used to travel on weekends when I was a senior resident to Kambala Hill Hospital and stays at Kemp Corner at a PG accommodation and see him operate live as an observer. One more person I would say was solely responsible of my venturing into cochlear implant because I was very young. They were so big surgeons in Delhi, they were so big institute like All India Institute, RML, Saftarjung, Maulana Azad Medical College, we just started. And they were program at Gangaram, very strong program and such senior surgeons that it was impossible to venture into this journey. So this guy, Mr. Anup Narang, he is the owner of Alps, and that time Digisonic implants were very popular in the country, launched it Dr. Arun Agarwal. And he gave me my first break and he told me, do you really want to get into cochlear implant? I have seen that you have the potential to do a cochlear implant. So we went for our first training to MXM lab in France. One of my more teachers, Dr. JC Pasi, is on the extreme left, the second left. He was with me, and this is where first time I got a complete idea about cochlear implantation. And then came plethora, number of training programs in the country. Me traveling with Professor Mario Sana at his center, learning the art of cochlear implantation, at World Hearing Center with Professor Skarzinski, Baha training, then university training at Zurich. It was endless and there was no stopping and there was no looking back. So I got trained into the latest technologies, everything in the country, so that I could give what people of our country, that these children of our country need, and they don't need to go abroad. I still remember, Arun sir, you will remember, the cost of implant at that time was about 16 lakh rupees and people used to go abroad to get surgery done. And thanks to our government, people, visionaries, that now the cost has come down to approximately 6 lakh rupees. But then my first step came when I operated a child from Gwalior, Rahul. I called up sir, I called up my teacher Dr. Milind Kirtane and he wished me luck. And this was when this time I was at Primus Hospital, Chanakyapuri. We did about 125 Digisonic implants. And after that, we did many firsts in the journey. This was Professor Mike Pringle from Southampton University. Sir clearly remembers we did the first binaural surgery in 2011. I was the first Indian surgeon to present a 1-hour instructional course in ESPCI at Lisbon by the European Council. That was a great honor. With the AB team, we did India's first mid-scale implant in 2014. And I was the first surgeon who started independent program in Nigeria. That's why we have so many patients. We did 19 cochlear implants in 1 year at Nigeria. This is where the base came, and Anas sir knows about it, that every time he has some query, I can refer that they can talk to my patients there. And I'm very happy to announce that what we achieved this time at Max Healthcare just few weeks back, Southeast Asia's first hybrid cochlear implant with innate processor in a 3-year-old child. This is for the first time which has happened, and we are so happy that the child is doing so well. This has been with the real support of my audiology team, my mentors and my admin. Then came a lot of mentorship workshop. In a few years I was learning, and then I started a mode of teaching. So I started about 18 programs in the country in government centers program, because there are very few good cochlear implant surgeons. So I'm into training mode, teaching new surgeons how to do cochlear implant, how to do an ethical practice, and the list is endless now. A token of appreciation. So my team, including me, Dr. Vinny, Dr. Sandeep, and now Dr. Amrit, we have given a heart and soul to Max Smart, to Max Saket, and now working at Max Panchil also. Really thankful to the entire management, everyone, that they have not left anything to appreciate us. Awarded with Value Award in 2017, then Max U Award of the Year, Clinical Excellence Award, Shushruta, and Long Service Award. Thanks to everyone. But in my journey, we were doing implants, I was training surgeons, but there was something which was missing, and it was a big gap. And implantee sitting here, parent sitting here, would actually realize what happened. So implant program is not just doing a surgery. Surgery is only 5 to 10% of the job. The main focus is auditory verbal speech therapy, which is the lifeline, and this is what pushed me to open something like what we dreamt of is SANKALP ENT. Can we have the sound? It's a complete audiology diagnostic for all cochlear implant. Any kind of test, research which is done in US, Europe is done at this center. With the expert hands of my audiologist, therapist, we work 24/7 to diagnose. We get so many patients who are not diagnosed in the correct way. They come with wrong reports from across India. But with the able team and leadership that we are able to see patients, we are able to give them therapy, psychological support, speech therapy support, AVT support, complete support. And many of you have been a testimony to this. And this completely complements the excellent surgery done at Max Sakir. I can tell you, in the 15 years of my practice and last 7 years at Max Healthcare, our infection rate in cochlear implant has been 0.000%. Not even a single patient has got infected, and whosoever has seen me noti, when they say slippers lying outside the theatre, it means there is an implant going on. My thanks to Dr. Gurpreet, who has stood by me in these 7 years. Bindu, our nursing, Manju, so that patients come to us now because they believe in Max Healthcare in terms of quality of service. So we were in the process of carving things. We could reach the half, but something was still left. What about the underprivileged? This is what used to bother me and Dr. Arun Agarwal. We used to discuss very often that what about those kids who cannot afford cochlear implant program or cochlear implant surgery? It's a very expensive surgery. So this is when we decided that we were lucky to get support by a trust from Mumbai, and Dr. Gurpreet knows that we have done about 10 cochlear implants where the trust provides free implant to any child who is less than 3 years and family income less than 5 lakhs. But what about those children between 3 to 4 years? Or what about those children who have money for the implant but they don't have money for the surgery? This is what inspired me to launch SANKALP Trust Foundation. We have been supported by our trustees. One of the trustees is Dr. Arun Agarwal himself. So we have a philanthropist, a leader, a spiritual leader, a guru, Swami Nalyanand Giriji Maharaj. He is from USA. He is a US citizen. He is PhD in Vedant learnings. He has done his thesis comparison between Gita and various other studies. So this is where we started SANKALP Trust Foundation. The main aim of the foundation is to create awareness, do camps across the country, provide hearing accessories to patients who cannot afford accessories. And initially, the trust is going to help Indian children, but we are going to make it globally. I am very thankful to one of our main supporters, Mr. and Mrs. Sandhu, who is sitting here in the audience, who have been a real supporter for the trust, helping us financially. We have been conducting camps, extensive camps in Punjab, Jalandhar, Dehradun, Hapur. We have done few camps, and the aim is to help as many children as possible. Now the journey was not complete without me and my teacher hosting a CGCon, Cochlear Implant Group of India conference, which was there in my mind since I became a cochlear implant center surgeon. And this is what I achieved last year, and we hosted the National Conference for Cochlear Implant Group of India. 550 registrations, 35 international faculty done at Leela. Sorry, and this feat we accomplished with the support of everyone. Finally, thanks to my team, the team that cares, including my manager Indu. She has been a rock solid support. Her counseling sessions have been so good that just she cannot do a surgery, but she can get patients from anywhere in the country. All my audiologists, OT nurse, staff who have worked with me, who have actually bared me in my maniac towards cochlear implant surgery, I have given a lot of scoldings to them, how to do it, care about, so that there is no infection rate. and my dynamic team with Dr. Vineet, Dr. Sandeep and Dr. Amrit. Last but not the least, the stronger pillar of my support in this last 14 years of my CA journey has been my lovely family. My parents, my wife, Dr. Pooja, who is right here, she's a professor at RML, my lovely kids, Kovid and Navya, they have not seen me during their young days because after 52 Sundays, I was traveling in North India doing camps. So I have not seen them growing. Even during my wife's pregnancy, I was never with her. I have no idea how did she pass 9 months of her pregnancy and I could just reach in time. She asked me, will you be able to attend the delivery or not? I said, sure, I will make sure that I stay at home that day. So thanks to all. And because of them, I am standing in front of you and I thank God, my patients, my teachers for all this. Thank you very much. I would just finish my talk by just a famous quote from a great visionary, a great leader, which I think all of you will agree that excellence is a continuous process and it is not an accident. We have to strive every day, and this comes none other than Dr. APJ Abdul Kalam. So let us strive for excellence so that we pledge to better your hearing to all these kids who can smile, who can enjoy life and go back to normal speed. Thank you. Now, donations to Sankalp Trust can be given. I can assure you we have helped quite families. These donations can be done through a QR code. We have standees placed outside. All this money will be used in. Sankalp Trust has also decided to fund education for 2 underprivileged children, 1 boy and 1 girl, who are cochlear implantees, so that they go to normal school. So the vision is quite big, and I'm sure I completely know that each step I take, Max Healthcare is going to take a step close by me, next to me, to make my vision come true. Thank you very much.
Thank you, sir, for enlightening us with so much of knowledge and your experience. I request Harshit, our cochlear implantee, to hand over the token of thanks to Dr. Vic. I would now like to request Dr. Arun Kumar Agarwal, President, South Hearing 2030, ex-Dean Professor of Excellence, Department of ENT, MAMC, to address his note.
Can I request everyone to mute, all on Zoom live can mute their mics? Please mute all of them. Everyone should mute. People who have joined us, please mute.
Good morning. I think after hearing Sumit, it seems I'm speechless. But irrespective of that, I will speak. Mridul, Sandeep, my colleagues in front of me, and the entire team, Sumit. I will request the entire team, Sumit, to stand. A big clap. As a teacher, what can be more satisfying to me than to hear such a success story? within a span of, I have to be here now because the camera is here for the Zoom link.
It's fine. Yes.
It's okay. I can.
Yes, yes. You can roam about.
That's right. So what can be for a teacher, such type of success story, Sumit, is the big asset. And that too within a span of 2004 onwards. I have taken over Dean that time, approximately, and that time Sumit joined me. And somehow स्टूडेंट्स तो बहुत आते हैं, बहुत अच्छे अच्छे हैं, एंड मुझे लग रहा था कि सुमित में एक डील है और उस डील के साथ his entire progress is very much in front of. रिस्पॉन्सिबिलिटी भी उसी को दी जाती है जिसमें कि टीचर को लगता है कि यस he or she can deliver. The journey of cochlear implant started. Cochlear implant मैं स्पेशली अपने मैक्स ग्रुप के साथ शेयर करना चाहूँगा मृदुल, हाउ मच इज द रिक्वायरमेंट ऑफ कॉक्लियर इम्प्लांटेशन इन आवर कंट्री. हम लोग 2 out of 1,000 लाइव बर्थ कंजेनाइटल डेफ बच्चे पैदा हो गए. उसके हिसाब से अप्रोक्सीमेटली 1,20,000 डेफ चिल्ड्रन we are getting into our society every year, and most of them are the candidate for cochlear implantation. मेरे साथ अनूप नारंग हैं एल्प्स के और की वाइफ. You will agree with me, ये तो केवल हम cochlear implant के hearing aid की बात तो बहुत ही ज़्यादा है, and this is only one segment. Congenital pediatric cochlear implantation. Then comes the adult implantation. And cochlear implant जब आया था मुझे याद है संदीप, I was in Commonwealth Fellowship in Oxford, and there the first cochlear implantation of the entire globe was undertaken in House Group of Institute, Los Angeles, and you know that was a failure. That got infected. But that was the beginning of the story. और आज के दिन globally, thousands and thousands of implants are being undertaken. In India, it started in late 90s, but I think early 2000 it picked up fast. And then the clinicians, the surgeons like Sumit, and he mentioned Dr. Kirtane, Dr. Mohan Kameshwaran, and there are so many who picked up, and now India is the destination for cochlear. पहले हम लोग बाहर जाने कराते थे, अब लोग बाहर से यहाँ. Of course, Sumit and your team, it is important for you to get a good infrastructure. And for that I would like to say thanks to Max for providing each and everything which is needed of the best quality. मैं वॉच करता हूँ, मैं तो मैक्स के साथ काफ़ी दिनों से जुड़ा हुआ हूँ. संदीप नोज की आपकी एक्सिस कमेटी के साथ जुड़ा हुआ हूँ, इसलिए वॉच करने का मौका भी मिलता है कि जिस तरीके से क्वालिटी केयर आप दे रहे हैं, उससे कॉक्लियर इम्प्लांटेशन प्रोग्राम कभी कभी मुझे मालूम चलता है कहीं पर भी इंडिया में कि कॉक्लियर इम्प्लांट प्रोग्राम शुरू हुआ, बिकॉज देयर इज सम सॉर्ट ऑफ लैक ऑफ केयर, सेटिस्फेक्शन नहीं होता तो वो प्रोग्राम बंद हो जाता है. बट दिस इज द परफेक्ट वर्कअप, द परफेक्ट सर्जिकल वर्कअप, then surgery, then follow-up, post-operative care, and as he said, the perfect team for the therapy, AVT. इन सब का कॉम्बिनेशन यदि चलता है तो हमारे सामने जितने भी बच्चे बैठे हैं अपनी फैमिली के लगता है दे आर द सक्सेस स्टूडेंट्स. The entire cochlear implantation program all over the world is very costly. I am also advisor to WHO, going to Geneva, meeting many of those who are doing big programs. Can I say, Sumit, we are the cheapest in the world
And the best, sir.
and the best.
This is the quality, sir.
What do you want? You want the best possible care and the cheapest possible care so that we have come here. इसको ऊपर लाओ. क्या नाम है आपका? Bhavna. So we have children like this in our country who can be benefited. Thank you. This is the journey, 500 implants. He must have started one implant, then 10, then 100, then 500. And Sumit, for your team, 500 is a good number, but I'm not satisfied. I'll come next time when it is 5,000. India needs you. India needs your team, your expertise. Of course, affordability is a problem. Besides the trust, what Sumit mentioned, I always say the three stakeholders which I will like every ENT surgeon to remember. The patient. Patient will be paying to the best possible of their capacity. The surgeon can also consider some sort of consideration and the hospital. If three stakeholders meet, then perhaps the maximum benefit can go to so many children who are in need of cochlear implantation all over. It's a wonderful beginning. My sincere thanks to Max for giving me the opportunity to be with you. Sumit, you have done very well, but you have done very well because I know it very well, Pooja's की वजह से.
That's true,
पूजा
sir.
कहाँ? कहाँ है बेटे खड़ी हो जा. इसकी तो सपोर्ट मिलती है पूजा. हमारी बिटिया की तरह है. Yes. And of course, everybody is better now.
Sir, I am the pampered in the house. Everything is ready for me because so that I can work. So that I can just work.
I reminded him yesterday.
That the whole family revolves around you so that you can just work.
And of course, all the parents in front of us who had faith in our system. This is the most important, Satish, that they must have faith in our system. For the clinicians, for the hospital, the entire system. And on behalf of MEX, I must say, शायद मैं एज में ज़्यादा हूँ, डॉक्टर मनी और हम वैसे डॉक्टर मनी मुझसे सीनियर
Sir, Amitabh Bachchan hai.
डॉक्टर भंडारी भी यहाँ बैठे हैं, डॉक्टर गुरप्रीत, everybody. So thank you very much, Sumit. It's my privilege to be amongst you and many more success to the entire team. Thank you.
Sir, just
Your journey and knowledge gives us the strength to move forward. I would now request our post-lingual implantee, Karthik, to hand over the token of thanks to Dr. Agarwal.
I would also welcome Mr. Amit Midda. Sir has joined us as Associate Vice President at Max Smart. Sir, a token of appreciation for you. Karthik. So with his skills coming from BLK, we now have we can hope that we are going to go miles and miles forward with under the supervision of Dr. Gurpreet. I'm sure Sir is going to visit us and not forget us. He's rarely seen at Smart now. And Sir, please fix up a date at Smart. Yes, we will always. Now we together will catch him.
Thank you.
I also want Dr. Sandeep Budhiraja, Clinical Director, PanMax India. Sir has been a real force in the clinical department. I'm glad that during COVID times we did publish quite few articles, and Sir is always a very positive force energy, and I must say that he has always given me thrust and push to do more, better and better. So Karthik, please felicitate Sir. Thank you, Sir. Keep on guiding us, enlightening us, and we want to publish as many articles so that we should be on the front. Thank you, Sir. Yes. So now we'll start the journey with our cochlear implantees. Poonam.
So now we will start our journey with the cochlear implantees from their own experiences. We start with Mr. Sachin Soni, father of our cochlear implantee, Ms. Nitya Soni. Please share your story, sir.
So I'll help with Poonam in moderating this session. So Nitya Soni, a beautiful child, resident of Lucknow. So I asked him, I said, you have so many centers in Lucknow, why are you coming to Delhi for a cochlear implant surgery? And I must tell you that I have been patients from across the world, from Pakistan, who love me even more than what my fellow Indians do, and they are live with us. This guy, the daughter was having hearing loss. He met me at Max Smart about 2.5 years back. The child was not profound deaf completely. She was using hearing aids. She was doing pretty okay. And I said, you wait. I think your child is doing very good. We should wait. Put the child on hearing aid, do the speech therapy, and wait for the right time. I cannot tell you how many hospitals tried to poach him in Lucknow. How many surgeons from Delhi promised him that we will come to Lucknow and operate. But he said only one thing. I will only get surgery by Dr. Mrik and at Max Healthcare and nowhere else. Thanks to Sachin. And I would like you to share your journey. How do you think Nitya has done? And Nitya is going to recite a beautiful poem for all of us. The moment we switched her on with the bilateral implant, she was talking to us from that very day. She is working on her speech clarity, but she can hear each and every sound in the world. She can talk. She's going to a normal speed. Yes, Sachin.
So, hello everyone. My name is Sachin Soni and she is my daughter Nitya Soni. And first of all, I would like to thank Dr. Mrik sir and their team for providing support and guidance for my daughter's journey. And yes, it is true. When I met first time with the sir, मेरे दिमाग में एक ही था कि कहीं से भी जाके मुझे करवाना सर से ही है, कहीं किसी और से नहीं करवाना है। Initially जब मेरी बच्ची 2.5 साल की थी, then I got to know about like she is having hearing loss. But उस समय initially मैं pediatric को दिखा रहा था, तो they were saying कि आपकी बेटी सही है, कोई issue नहीं है. बट जब समय बीतता गया तो वी गॉट टू नो लाइक इसको हेयरिंग में प्रॉब्लम है, वी स्टार्टेड ऑब्जर्विंग एट होम एंड देन हम ENT से मिले वहाँ पे, दे सजेस्टेड कि आपकी बच्ची को सुनने में इशू है और आपको फ्यूचर में इम्प्लांट कराना है. बट इनिशियली that moment I got to know about Dr. Briggs sir and then visited his clinic at in Max Hospital. So सर ने बोला कि आपको अभी प्लांट की जरूरत नहीं है, इनिशियली यू कैन गो विद हेयरिंग एड अलॉन्ग विद द स्पीच थेरेपी. बट हाँ, एक चीज़ उन्होंने बोल दिया था कि स्टार्ट एक्यूमुलेटिंग द मनी, फ्यूचर में आपको जरूरत पड़ेगी, बच्ची का कभी भी पड़ सकता है. बट उसके बाद भी हमने जब लखनऊ में थेरेपी स्टार्ट किया और बेटी का हमने हेयरिंग एड पे, सो वी आर गेटिंग गुड रिस्पॉन्स. बट उस टाइम में एटलीस्ट ऐसा था कि जैसे जैसे इसका एज बढ़ता गया तो हेयरिंग इसका लॉस और बढ़ता गया. तो उस समय ऐसा था कि वहाँ पे कई लोगों से मैंने कनेक्ट किया, बट उन्होंने यही बोला कि हम कई सारे डॉक्टर को बुला देंगे. बट मेरा यही था कि आप बुला सकते हो तो डॉक्टर मिक्सर को बुला दो, मैं लखनऊ में करा दूंगा, अदरवाइज मैं दिल्ली जाके ही करवा दूंगा. बिकॉज आई वॉज लुकिंग फॉर वन स्टॉप सोल्यूशन कि एटलीस्ट मैं जाऊँ तो मुझे सारी चीज़ें वहाँ से मिल जाए. बट वहाँ क्या था कि वो डॉक्टर को बुलाएंगे, डॉक्टर करके चले जाएंगे, फिर उसके बाद मुझे मेरा क्या होगा, मेरा परसेप्शन था, मे बी आई एम रॉन्ग, बट मेरा था कि कैसे फिर उसके बाद मैं उनसे टच में रहूँगा, कनेक्ट करूँगा. So I decided I'll go with Dr. Briggs sir.
I told him one thing, that's I have seen the worst centers in my life when I go to government hospitals to train. The infection rate in hospital is close to 10%. So if 100 implantees are done, 10 of them are excluded. And I have personally excluded 4 implants at Max Care by other surgeons in the city. I told him, I can give you one thing, which is sterility, and I can give you 100% guarantee on that. If your child's surgery fails, then you are responsible. And he spent quite a good amount of money. I think he spent around more than 30 lakhs on his child. I said, don't take this chance just for a few lakh of rupees. Come to Delhi, get the surgery, therapy you can get done back in Lucknow. And he agreed to it.
और जब she was using hearing aid तो उसके बाद स्कूल जाना शुरू किया तो हमें पता लगा कि धीरे धीरे जैसे स्कूल में फीडबैक मिलता था, बट हमने भी कंपैरिजन थोड़ा शुरू किया तो थोड़ा थोड़ा हमें लगने लगा कि इसका लॉस बढ़ रहा है. और एक स्टेज के बाद मुझे नहीं लग रहा था कि इसका इम्प्रूवमेंट हो रहा है. हमने भी ऑब्जर्व किया, सर ने भी सजेस्ट किया, तो फिर हमारा ये माइंड सेट हो कि हमें भी इम्प्लांट कराना है. एंड हम जो भी था हमारा पहला था कि एटलीस्ट हमारे पास उतना अमाउंट नहीं था, तो फर्स्ट वी डिसाइडेड फॉर यूनिलैटरल. बट फिर हमने डिसाइड किया कि इन फ्यूचर अगर हम 1 साल बाद 2 साल बाद प्लान करते हैं तो इस बेटर की एटलीस्ट कहीं से भी अरेंज करके इफ यू गो विद द बायलेटरल तो एटलीस्ट बच्ची का फ्यूचर और सुनने में आसानी रहेगा, एटलीस्ट सी कैन टेक इजली. तो हम जो चीज़ 2 साल पहले प्लान करें तो एटलीस्ट वी डिसाइडेड टू गो विद इन द वन गो फॉर बायलेटरल. तो उससे इम्प्रूवमेंट मिला. वी हैव टू ऑल द एसेट ऑल आवर सेविंग्स इवन वी बोरो द मनी, बट हमने अपना फ्यूचर लगा दिया इस पर कि एटलीस्ट कि एट दिस मोमेंट वी आर पुटिंग ऑल दिस थिंग्स, सो इन फ्यूचर्स मे बी हमें उससे बेनिफिट मिलेगा. तो एटलीस्ट वो अपने फ्यूचर में अगर वो अपने पैर पे खड़ी जाती तो दैट इज माय एसेट ओनली. सो मेरे लिए वो मोमेंट ज़्यादा बेटर है कि अगर मैं अभी इन्वेस्ट कर देता हूँ मे बी, क्योंकि है सारा इसी का, मेरा कुछ नहीं है अपने बच्चों के लिए.
सचिन, मुझे ये बताइए कि अब नित्या नॉर्मल स्कूल जाती है?
जी सर, आई इवन स्कूल से भी फीडबैक मिलता है. इनिशियली जब वो हेयरिंग एड पे थी तो वो कन्वर्सेशन नहीं करती, तो ओरली रिटन में सी इज गुड, बट ओरली डिस्कशन में कन्वर्सेशन में
क्या आप नित्या ओरली सही है? क्या हम नित्या से कोई पोएम सुन सकते हैं या नित्या आपसे बात करें? नित्या, आप हमें कुछ सुनाओगे आज?
बोलो नित्या, हाय बोलो,
आप बात करो.
हाय बोलो.
Hi.
व्हाट इज योर नेम? व्हाट इज योर नेम? बोलो.
नित्या
My name is Nitya Tony.
नित्या हमें एक अच्छी सी पोएम सुनाएगी. नित्या ने कौन सी पोएम लर्न की है? सुनाओ.
पोएम सुनाओ. नहीं, स्टार्टिंग से, इंट्रोडक्शन से, स्टार्टिंग से.
वेरी कॉन्फिडेंट चाइल्ड. नित्या सुनाएगी हमें कोई पोएम.
तो पापा नहीं है.
Hi, मेरा नाम टोनी है. मैं 5 व्यक्ति हूँ. मेरे स्कूल का नाम किंगम है. मैं केजी में पढ़ती हूँ. मैं आज आपको पोएम सुनाऊंगी.
So you see, she was hearing earlier also, but with implant, her high frequency losses she's been able to pick up. She's going to a normal school. We are working on her speech therapy. So I would say that, surgical part is only 10% of the journey. The 90% of the journey is good AVT and speech therapy. I think all the parents sitting here do realize. For a child who is implanted at 11 months of age, we'll catch up with a child from Pakistan, Ayan. We implanted him when he was 9 months of age from Pakistan. And he barely could get therapy support. We did some teletherapy. He's absolutely flawless. Nobody can say that he was ever deaf. So age of intervention and age of implantation is very important, and this is what we are fighting in the country, to bring the age of intervention down. There are so many modes of treatment available. People go to Ayurveda, homeopathy, Jharkhand Baba, and who knows? And I think Dimple sitting here knows better than me that she wasted 3 years. So many people waste 3 years because people give false hopes that everything will be fine. तेरा प्यो भी लेट बोलिया सिगा कोई गल नहीं. So all these kind of things, you know, and let me tell you, boys are the biggest duffer in their childhood. Boys are slow, including me. I was very slow during my childhood. Never. So girls pick up very fast and boys are very slow. So thank you, Nitya. Keep on working hard with your speech. And now we invite Nitya. Would you like to finish your poem? Would you like to finish your poem? Society. हमें एक ऐसा एग्जाम्पल सोसाइटी में डालना है जिससे हर इंसान को लगे कि एक कॉक्लियर इम्प्लांट वाकई में काम की चीज है. सो पेशेंट सिलेक्शन इज इम्पोर्टेंट.
So we have heard a number of success stories. एक करेक्टिव भक्ति गीत के साथ हम कार्तिक को बुला रहे हैं यहाँ पर एक डांस प्रेजेंट करने के लिए.
So music perception is also a very important component of cochlear implant. अगर cochlear implant में बात करना ज़रूरी है तो डांस करना भी बहुत ज़रूरी है. और हमारे साथ हैं कार्तिक. कार्तिक एक इम्प्लांटी है. मैं आपको कार्तिक का बताऊं कि कार्तिक को भी प्रोग्रेसिव लॉस हुआ जब ये छोटा था. सडन डेफ नहीं हुआ बट प्रोग्रेसिव लॉस हुआ. ही इज़ अ वेरी लेट इम्प्लांटी. इनफैक्ट पेरेंट्स को हमने बहुत समझाया बट पेरेंट्स की डिटर्मिनेशन इतनी है और फादर है, ये दोनों आज भी अपने बच्चे की थेरेपी कराने आते हैं. आज भी हमारे सेंटर पे थेरेपी, सब कुछ सुनता है, सब कुछ समझता है, सब कुछ बोलता है. क्लैरिटी थोड़ी सी इंप्रूव हो गई. कार्तिक, मैं चाहता हूँ आप पहले अपने आप को इंट्रोड्यूस करें. आपको अपनी स्पीच पे काम करना है, ये हम सब जानते हैं और आप इसके लिए निरंतर प्रयास कर रहे हैं.
नमस्ते, मेरा नाम कार्तिक है. मैं 8th क्लास में पढ़ता हूँ. मेरे स्कूल का नाम सेंट एंड्रूज है.
कार्तिक अपनी स्पीच पे काम कर रहा है. ऑडिशन बहुत अच्छी है, हर चीज समझता है क्योंकि बहुत लेट इम्प्लांटी है. अगर यही इसका इम्प्लांट 2-3 साल में हुआ होता तो आज इसकी स्पीच बिल्कुल क्लियर होती. यही एक मेन फोकस है अर्ली इम्प्लांटेशन, जिस पे हम फोकस कर रहे हैं. तो कार्तिक, आप रेडी हैं अपने सॉन्ग के लिए, डांस के लिए? on dancing till evening. You know, he's such a fantastic dancer. He keeps on sending his videos to me. But yes, Karthik, you promised all of us कि आपने अपनी स्पीच पे काम करना है. आई वॉन्ट यू दैट इन द नेक्स्ट 2-3 years, जैसे मोहम्मद अकबर खान ने अपनी स्पीच पे काम किया है, 3 साल में इसने अपनी स्पीच इतनी इम्प्रूव की है कि आज ये बिल्कुल नियरली नॉर्मल बोलता है. थैंक यू कार्तिक.
Wasn't that heart-throbbing? Okay, so after this, we would like to request Mr. Mahesh. Mr. Mahesh is our adult hair implantee. He would share with us some of his experience with cochlear implant.
बहुत लोग जानते नहीं कि महेश जो हैं वो हमारे यहाँ जो आईटी में विजेंद्र हैं उनके मामा जी हैं. तो महेश जी को हेयरिंग लॉस था, प्रोग्रेसिव लॉस था. ये एक नेता हैं और एमसीडी के चुनाव में अक्सर आपने इनका नाम सुना होगा. ये लड़ते रहते हैं चुनाव. और मैं चाहता हूं कि महेश जी बताएं कि आई थिंक ही इज वन ऑफ द बेस्ट कैंडिडेट्स आई हैव सीन कि हमने इनको 2 बजे प्रोसेसर लगाया और 3 बजे ही वाज ऑन हिज ओन. ये बोले डॉक्टर साहब मैं तो बिल्कुल नॉर्मल हो गया 1 घंटे के अंदर. मुझे कभी लगा ही नहीं कि मैं सुन नहीं सकता था, क्योंकि महेश जी को प्रोग्रेसिव लॉस था, हेयरिंग एड यूजर थे, बट हेयरिंग एड्स इनको काम नहीं कर रहे थे. तो मैं चाहता हूँ इनकी जुबानी सुने हम इनकी कहानी.
बहुत धन्यवाद डॉक्टर साहब. मैं जितना आपका धन्यवाद करूं उतना काम है. आज मैं आप सबके बीच में खड़ा होकर जो बोल रहा हूं, और आज मैं अपनी दिनचर्या को जो मैं सुचारू रूप से चला रहा हूं, क्योंकि एक पॉलिटिशियन होने के नाते सार्वजनिक जीवन है, बहुत सारे लोगों से पब्लिक डीलिंग का रोज का काम है, और मैं उसको सुचारू रूप से कर रहा हूं. उसके लिए आप बहुत बहुत धन्यवाद के पात्र हैं डॉक्टर सुमित मिरिक जी. सन 2016 में दिल्ली में कॉरपोरेशन के चुनाव हुए थे, उपचुनाव 13 सीटों पर. तो 2016 मई में ये चुनाव हुए थे, 16 मई को. तो उस चुनाव के अंदर मेरे बड़े भाई कैंडिडेट थे, इंडिपेंडेंट चुनाव लड़ रहे थे हम. लेकिन इतनी ज्यादा डिस्टर्बेंस हुई थी, इतनी ज्यादा पब्लिक डीलिंग. मेरे कान में पहले छोटी मशीन लगी हुई थी इस तरह की, लेकिन उस बहुत ज्यादा जब काम का वजन था तो वो सब काम छोड़ गया. चुनाव में तो बीच में छोड़ नहीं सकता था, लेकिन भगवान के आशीर्वाद से चुनाव हम जीत गए. और 3 जून 2016 को मैंने डॉक्टर साहब के 2 जून को एडमिट हुआ. 3 जून को डॉक्टर साहब ने मेरे कॉकलियर प्लांट मुझे लगाया, और 20 जून को आपने जैसे ही ये ऊपर वाला पार्ट लगा के जैसे ही लगा, एकदम से इतनी सारी आवाज आई. मैंने कहा पैसा तो पानी में गया, अब कुछ होना भी नहीं है. एकदम से इतनी डिस्टर्बेंस हुई, लेकिन ठीक आधे घंटे के अंदर मुझे इतना इम्प्रूवमेंट, ठीक आधे घंटे में. डॉक्टर साहब ने कहा 1 चक्कर हॉस्पिटल का लगा के आओ, बाहर पार्किंग तक जाओ आप. मैं जैसे ही बाहर पार्किंग गया तो जिन आवाजों को, क्योंकि 30 साल से हेयरिंग लॉस धीरे धीरे अभी उस टाइम मेरी एज 50 साल थी, अब 57 ईयर्स. तो 30 साल का हियरिंग लॉस था. मैं उन आवाजों को भूल ही गया था. जैसे हेमलता जी ने अभी बताया, चिड़ियों की चहचहाट, पक्षियों की कोई आवाज, गाड़ी का हॉर्न ढंग से सुनना, मैं सब कुछ भूल ही गया था. ऐसा भी होता होगा. मैं सिर्फ अब उसी को ईश्वर की कृपा और अपनी मजबूरी समझ के किसी तरह अपनी जिंदगी को जी रहा था, ढो रहा था किसी तरह. लेकिन डॉक्टर साहब ने ये इतना बड़ा काम मेरे लिए और मेरे चाहने वालों के लिए, मेरे मित्रों के लिए, खासकर मेरे परिवार के लिए, और अब आपके आशीर्वाद से, जैसा आपने बताया, उससे अच्छी कोई चीज नहीं है. मेरा भी एक पोता है 3 साल का, और जब मैं उससे बात करता हूं तो आपको जरूर धन्यवाद करता हूं, आपको जरूर याद करता हूं. नहीं तो मैं तो कर ही नहीं पाता ये सब कुछ. मेरा सिर्फ कहना मानना यही है डॉक्टर साहब, आपसे मेरी ये गुजारिश है कि सब लोग अफोर्ड भी नहीं कर सकते, बहुत महंगी चीज है. अगर कोई इसका भी रास्ता आप निकाल सको तो वो भी निकालो, ताकि ज्यादा से ज्यादा लोग इसका फायदा उठा सकें। एक और सबसे बड़ी बात कि इसका नुकसान कुछ नहीं है, आपको जो भी होगा फायदा ही होगा, नुकसान कुछ नहीं होगा इससे। हम भी डरते थे बहुत बड़ा ऑपरेशन है, बल्कि मेरी तो सिर की जो स्किन है वो इतनी मोटी थी कि डॉक्टर साहब की वो तो फेल हो गई थी, 3 घंटे स्ट्रेचर पर लिटा कर रखा था। और दूसरी इन्होंने जब मंगाई तो फिर वो, और मैं तो बस इससे ज्यादा आपको क्या कर सकता हूँ, आपका धन्यवाद कर सकता हूँ डॉक्टर साहब, आपका धन्यवाद कर सकता हूँ, आपने मुझे इस लायक किया। और इस क्षेत्र में जो मैं कर सकता हूँ, अगर मेरी कभी किसी तरह की जरूरत पड़े तो मैं हमेशा आपके लिए तत्पर रहूंगा। बहुत बहुत धन्यवाद। जय हिंद, जय भारत।
थैंक यू महेश जी। महेश जी हमारे ना स्टार पेशेंट हैं, हमें जब भी इनकी जरूरत पड़ती है ना, ये नेता है तो इसका बड़ा फायदा होता है। हम इन्हें बहुत पब्लिक मीटिंग्स में ले जाते हैं, हमें रोटरी में टॉक देनी होती है, महेश जी चल देते हैं। महेश जी कहते हैं डॉक्टर साहब खाना अच्छा खिलाते हैं ना, बाकी मैं कहीं भी आ जाऊंगा। तो he has been a real inspirer to us, and you know he is a excellent success story how an adult cochlear implant should be. मैं इनको कब से बोल रहा हूँ, ये इस बार का चुनाव हार गए, इन्होंने पैसे सारे वहां लगा दिए, अब इनके पास इम्प्लांट के पैसे नहीं है। इन्होंने ये नहीं बताया कि इम्प्लांट महंगा है, इन्होंने ये चीज नहीं बताई कि कितना पैसा इन्होंने इलेक्शन में इस बार वेस्ट किया है। तो ये मुझे बार बार कहते हैं कि आप डॉक्टर गुरप्रीत से बात करो, कुछ डिस्काउंट दें। मैंने कहा जी आप अगली बार इलेक्शन मत लड़ना, 25 बच्चों का इम्प्लांट फ्री करा देना। चलिए,
Thank you, Mahesh ji. We now have a success story from one of our implantees who was implanted at a very early age and is doing great. So his success story from we'll hear from his mother and himself.
So खुशबू जो है अद्वैत की मदर है। अद्वैत का सर्जरी हमने 15 महीने में किया। You know, we are constantly trying कि we should bring down the age of implantation to 9 months. अगर ये मुमकिन है, डॉक्टर अग्रवाल के साथ मैं मिनिस्ट्री ऑफ हेल्थ और सोशल जस्टिस एम्पावरमेंट में काम कर रहा हूँ। A SIGI office bearer. I am working with central government health ministry to integrate universal newborn screening program, hearing screening program with universal immunization program, जो pediatrics वाले रन करते हैं। So we are trying our best and I think within 1 year जो बच्चे इम्यूनाइजेशन कार्ड लेके घूमते हैं, पेरेंट्स लेके घूमते हैं, उसमें सबसे एंड में लिखा होगा ओटो अकूस्टिक एमिशन और बेरा। यानी कि अगर कोई भी बच्चा किसी भी पीएचसी डिस्पेंसरी में जाएगा जहां पे लिखा होगा कि बच्चे को टीका लगा है, डीपीटी लगा है कि नहीं लगा है, नीचे आंगनवाड़ी वर्कर, हेल्थ वर्कर ये चेक कर सकता है कि क्या इस बच्चे की स्क्रीनिंग हुई है। सो हमारी ये मुहिम पिछले 3 साल से मैं और डॉक्टर अग्रवाल कर रहे हैं। अनफॉर्चुनेटली कोविड आ गया, वी मेट द हेल्थ मिनिस्टर, बट नाउ द प्रपोजल हैज बीन सेंट एंड आई थिंक विद इन द नेक्स्ट 1 ईयर इसमें अगर हमें सफलता मिलती है तो मैं कहूँगा कि ये स्यापा ही मुक जाएगा। जो एवीटी थेरेपी की प्रॉब्लम है पूरे कंट्री में, हम 9 मंथ्स 6 मंथ पे बच्चे डिटेक्ट कर पाएंगे, 9 महीने पे उनको ऑपरेट कर पाएंगे। देखिए गवर्नमेंट इम्प्लांट्स तो देती है फ्री, बट थेरेपी की बहुत प्रॉब्लम। दिस इज वेयर प्राइवेट प्लेयर्स हैव टू पिच इन बिकॉज वी रियलाइज दैट सर्जरी इज नॉट दैट इम्पोर्टेंट, थेरेपी इज इम्पोर्टेंट। वन ऑफ सच चाइल्ड, Advait, like Dr. Agarwal also said, it is the faith of the parents and the surgeon and the institute who get the surgery done. So let's hear it out. Is adequate?
We visited a lot of hospitals and doctors. To understand that he's having profound hearing loss with 80%. My name is Khushbu and I'm Advit's mother. Advit was a year old when we found that he has got a hearing loss. We visited a lot of hospitals and doctors and we got the Bera test and I got to understand that he's having profound hearing loss with 80% hearing impairment. We were suggested by everyone for a CI, which is cochlear implant. Mr. Sumitra gave us a very good, understanding about bilateral cochlear implant. With bilateral cochlear implant, we could understand that the baby can have the same growth as like the other child, and the age was very correct. This age from 2 years to 5 years is 1 year to 5 years the age when the child develops most of his motor skills. So if we get the cochlear implant in that age within 1 to 2 years time period, the child can have streamlined growth within a 6 months therapy sessions and all. So we were lucky enough to understand this thing, and we took the decision of having cochlear implant surgery done within a month, within a month's time. So on 13 June we got to know that he is having hearing loss. On 13th August we had done his cochlear implant, and I can assure you guys that within 6 months or 9 months therapy sessions, the child is really happy with the decision we took at the right time. And I would suggest everyone who gets to know that there is hearing issue and on right time, please take right decision and have CRE done. Thanks a lot.
Now you can see Advait started getting ABT therapy, very small child, 15 months, and see the response of the child when he started listening. Volume.
Where is the teeth? Oh, nice. The teeth are आपकी छोटी छोटी है. Okay.
Close your mouth.
So see, he is able to understand. He is listening to understand what everybody is saying. Now you see, after a few years, this is after 2 years, he has grown up.
What is your name? What is your father's name? Can you sing a rhyme, please? Rhyme सुना दो एक. Rhyme सुना दो एक.
So very, very moody child, but he speaks very well. He will be going to a normal school. Absolutely normal school. He can hear even somebody knocking at the door from far off.
ऐसे ऐसे अभी ठीक हो जाएगा, मम्मा ठीक कर देगी. ऐसे
Now let me tell you, the earlier implant you do, the support for speech and ABT goes drastically down. So for children who are far from Delhi, we have to push them that they should get surgery as soon as possible, because I understand people cannot leave their job and come and stay in Delhi for therapy for 2 years. And this is primarily what happened with Advait. They just came to us for 6 months and now they are on their own. Now I am going to share you a very beautiful journey of another teacher, Mrs. G.K. Gill, with a Baha implant. Baha implant is also an implant for someone which is a bone conduction device. I implanted her 14 years back. She is also a teacher, and listen what she has to say. Volume.
में ये प्रॉब्लम बहुत ज़्यादा बढ़ गई. मैंने बहुत सारे डॉक्टर्स को कॉन्टैक्ट किया, उनको अपनी प्रॉब्लम बताई, लेकिन कोई सक्सेसफुल नतीजा नहीं मिला.
फाइनली एंड लकीली मैं डॉक्टर स्मिथ ब्रग से मिली। उन्होंने मेरी प्रॉब्लम को समझा, जाना और ये डिसाइड किया कि बाहर इम्प्लांट करना होगा। 2011 मार्च के महीने में मेरा ऑपरेशन हुआ और बाहर इम्प्लांट किया गया। ये इस तरह का एक डिवाइस है, ये रिसीवर है जो इम्प्लांट पर लगा दिया जाता है। उसके कुछ टाइम के बाद मेरी hearing काफी improve हुई। मैं आराम से सुन सकती थी, समझ सकती थी, जवाब दे सकती थी। सोशल गैदरिंग्स में मैंने जाना शुरू कर दिया और अब इतने सालों के बाद मैं आराम से सुनने में मुझे बहुत ज़्यादा परेशानी होती है। एक बात मैं और कहना चाहूँगी, कोई भी उम्र हो, अगर हमें सुनने की कोई प्रॉब्लम है तो हमें जल्दी ही डॉक्टर से कॉन्टेक्ट करना चाहिए। जिस तरह से हम चश्मा लगाते हैं इसी तरह से हम हेयरिंग एड भी दे सकते हैं, पहन सकते हैं। और उम्र उसमें कहीं किसी तरह की रुकावट नहीं, एज इज नो वन। सो आप अगर सुनने की किसी भी प्रॉब्लम से पीड़ित हैं तो डॉक्टर से कॉन्टेक्ट कीजिए। डॉक्टर सुमित ब्रग इस क्षेत्र में काफ़ी कमिटेड हैं और वो इस तरह की प्रॉब्लम को समझ कर इन सब के निवारण में काफ़ी अच्छे हैं। थैंक यू सो मच।
So Mrs. Gill, she's in Vietnam right now, and she sent us this video. She's with her, two children. Now we have another parent, Dimple. And Dimple is with her daughter Bhavya. Bhavya, you can also come. Husband is also there. So Dimple is a very inspiring and very difficult story, I must tell you. Inspiring in a way that Dimple never left hope, and so didn't we with her. So Bhavya was diagnosed with hearing loss. She came to me when Bhavya was 2 years of age. I counseled her, I told her, please get your child implant done. Now Bhavya is not a normal child like other profound deaf kids. Bhavya has profound deafness, but she has malformations anomalies also. So the diameter of the nerve which enters the cochlea is 1/10 of the size of the nerve which enters a normal cochlea. So what we diagnose as hypoplastic cochlear nerve. Apart from hypoplastic cochlear nerve, she has IP2 deformity. So God has given her profound deafness, but apart from that, even the cochlea is not normal and the nerve is also not normal. She came to me when she was 2 years. I told her, get your surgery done, but she did not understand that. She went to another surgeon. I will not like to name the surgeon, who said, don't worry, your child is normal, she will start speaking in 3 months.
It's just speech delay as
It is speech delay and very
like as there is no one in my family who has this problem, so I was not ready for this. I thought she would like wear hearing aids and we can start with the therapies and all, and then later on she would be a normal child. But I had to accept it that she would be wearing, like she would go for surgery. Even during her, even on her surgery day, like at the time of her treatment, like I was just crying कि नहीं करवा सकती थी शायद मैं, but ठीक है. Today Bhavya goes to a normal school. She's in grade 3. She's able to hear everything. Though we are working, it's not that clear that everyone can understand. But yes, she's a better child now. Like I don't get any complaints from her teachers. And I am really hoping that one day she would speak clear and would speak to every one of you and say thanks to Dr. Sumit and his team when she grows up. And as of now, I would like to say thanks to Dr. Sumit and his team here. Thank you for your support and guidance anytime. Like whenever I had any query in my mind, I used to text her. So this is the problem. Or Yashu ma'am or Samriddhi ma'am, like who took her therapies, ABTs, speech therapies and all. So whenever I had any query, any doubt in my mind, like be it 7, 8, any time, they would respond back to me, and I'm thankful to them for their response. Thank you, sir. Thank you for your guidance.
Thank you, Dimple. Thank you, Dimple. I know better late than never. I think we will
Yes,
catch
one
up.
more thing.
Yes.
What I have learned now is like if I would have got her surgery done earlier, like at the age of 2, her speech would have been better. Just like normal kids, her speech would have been natural. So just a request to everyone, like whosoever has diagnosed this problem, please get the surgery done sooner. Thank you.
Thank you, Dimple. Thank you for sharing your views. I'm glad we could help Bhavya, such a pretty girl, such a lovely child. And I'm sure one day, very soon, she's going to catch up with the rest of the children.
Thank you, ma'am. I would now like to request Mishita, our cochlear implantee, to share a poem with us. Mishita.
So Mishita is an implantee. The father is a brother in a government hospital. He left government medical college and came to us that I want sterility, I want quality. And although implant was happening at Maulana Azad, but he chose us. And I'm glad, and Mishita is doing very good. She's going to a normal school. Maybe Tarun, you can come up with her on stage. You know, Mishita, how are you? आप कैसे हो? आप कैसे हो?
मैं ठीक हूँ।
आप किसके साथ आए हो? आपके साथ कौन आया है मिशिता?
नानी नानू।
नानी नानू आए हैं, पापा मम्मी नहीं आए। तो आज आप क्या सुनाओगे हमें मिशिता? पोएम सुनाओगे? सुनाइए, पोएम सुनाइए। Thank you, Mishita. Again and again, I always tell parents, these children hear everything, they speak. We have to keep on working every day, every month with their speech. Articulation is very important. The first step is auditory verbal therapy, यानी कि सुन के बोलना. The second step is जब आप सुन पा रहे हैं, बोल पा रहे हैं, speech articulation. आप ये देखिए, एक बच्चा जब पैदा होता है, पहले दिन से दादा दादी नाना नानी माँ बाप मुन्नू कैसा है अले सारा दिन बोलते रहते हैं, उसकी जान खाते रहते हैं. बच्चा क्या 1.5 साल पे बोलता है मामा पापा बुआ. वो 1.5 साल तक बच्चा अपने ब्रेन में सिर्फ साउंड को रजिस्टर कर रहा है, कंडीशन कर रहा है, और एक दिन वो आवाज जो सुन रहा है वो जबान के जरिए शब्दों में कन्वर्ट होके आती है. आप ये सोचिए, अगर हमने एक 2 साल के बच्चे का या 5 साल के बच्चे का इम्प्लांट किया तो वो उसका पहला दिन है. That is the first day in the life of that child when that child starts hearing. तो हमने क्या किया? हमने 5 साल वेस्ट किए. आज मैं एक 70 साल के इंसान को बोलूं कि साइकिल सीखे और एक 5 साल के बच्चे को बोलूं 5 साल का बच्चा 2 घंटे में साइकिल सीख लेगा. बिकॉज ब्रेन प्लास्टिसिटी, ब्रेन जानता है कि हर काम यंग एज में बच्चों में जल्दी से सीखा जा सकता है. जितना समय हम वेस्ट करते हैं वो सेल्स डाई कर जाते हैं, रिसेप्टिवनेस कम हो जाती है, उसकी लर्निंग पावर ये कम हो जाती है. तो हमें दुगनी मेहनत करनी पड़ेगी, हमें तिगुनी मेहनत करनी पड़ेगी जैसे जैसे बच्चे की उम्र बढ़ती जाएगी. और ये इसका उदाहरण कॉकलियर इम्प्लांट के बच्चों के अलावा, पेरेंट्स के अलावा कोई नहीं जानता. आप सबने सब प्रकार के बच्चे देखे, आप खुद समझदार हैं कि इम्प्लांट कब होना चाहिए. थैंक यू मिशिता.
Thank you, Mishita. We have another cochlear implantee with us, Miss Rishika, who is here to share something with us. Rishika, please come.
Thank you, Sachin, for making it. Sachin, very, very dear friend. Wife is expecting the second child, but still he made it. Third child, still he made it from Haryana. Rishika has been a star patient for us. She was born normal. like any other child. The child was hearing normal, speaking normal, but she had some viral infection at the age of 2 years and she became completely deaf. The parents were shocked what to do. They came to us but they took the right decision and they got the child cochlear implant surgery. ऋषिका, आप कैसे हो? आज आप हमें क्या सुनाओगे? गणेश मंत्र ये लीजिए.
जय गणेश जय गणेश जय गणेश देवा माता जाकी पार्वती महादेवा पान चढ़े फूल चढ़े और चढ़े मेवा लड्डूअन का भोग लगे संत करे सेवा एक डंट गया वंत चार पुजारी मस्तक सिंधु सोए मुझसे की सवारी अड्डन को आँख दे कोरिन को काया महाजन को पुत्र दे निंदन को माया जय गणेश देवा. Thank you. Have a nice day.
Thank you, Rishika. God bless you. And she's a true example of how parents, how everybody focuses onto a child, how everybody pushes the child to its limits, and you see the result. Can you believe that she was deaf? She was profound deaf. She couldn't even hear a word. And now she goes to a normal school. And I must congratulate my team of therapists. They have done an excellent job. And the parents. And such receptive parents. I can tell you, anytime, 24/7, even at 12 o'clock at midnight, if we receive a call, any of our team members get back to them. Sachin, am I right?
Yes.
Are you?
You are not a common man, you are a superman.
So I have such kind of connect with such children. I tell my wife and my children, I eat cochlear implant, I drink cochlear implant, I sleep cochlear implant, and sometimes they tell me, we have not seen a crazy person like you. Nothing comes in your mind. Whenever you get an implant patient, you will. Yesterday I was counseling a patient in Mumbai at 12 a.m. for a bilateral cochlear implant. He said, you have a program tomorrow, why don't you sleep? The patient is not going to go anywhere. So I spoke to Dr. Gurpreet, sir, can we go to Mumbai and do the implant? He said, why not? Go. So, because I think that to reach somewhere, you need to have that passion, that junoon. And it is not just with me. Indu is with me. I scold her. We have an excellent team. I must tell you, I must thank God. God has not only given me lovely wife, parents, my children who understand my passion for cochlear implant, my team members, my manager, my audiologist, therapist. They know that sir will go to any extent when it comes to cochlear implant. So thank you. And Poonam, let's hand over the mic to the man in charge of SANKALP complex, Dr. Gurpreet.
I would now like to request Dr. Gurpreet Singh, Senior Vice President and Unit Head Hospital Operations, SANKALP Complex, to address his vote of thanks.
Good afternoon all of you and namaskar. Thank you first of all Dr. Mrit for organizing this. It's been an amazing journey, and what best than you see people sitting here and the results in front of you. Amazing work, and if we can change the life of kids like Bhavya and have parents like ma'am, it's really heartwarming what we all do and what we all can do. So just a few takes from what has been going on since now, and yes, he's crazy about cochlear implants, that's for sure. So a few takes, one of which is I think we need to get it done early. That's the most important. The second important part is the speech therapy. We should really look for that speech therapy as quickly as possible. And the third thing is you should have trust and faith in your doctor. Those are the three most important things which are there. So I've been attending since the start of this session, and there's a very interesting thing which happened here. You saw a different aspect of life. You saw a passionate student. You saw a teacher who was grateful for what his student has achieved and the pride he had. You had a family who is fully dedicated and supportive for the cause that this man is driving, and the team that he has been through him through thick and thin. And for us at Max Smart, we are just a very small piece in this entire puzzle. But we try and fit in wherever it's possible. I know I start getting calls the moment he fixes a cochlear implant for either for the cost or for the landing or for the OT, whatever. But he takes it with so much passion, and that's why you see the results in people all around you, which is either kids or grown-ups, people like Maheshji. So really important that we all as a society should come together and bring down this problem and kind of give life to as many kids and as many adults, younger or older, who can then really see what beauty lies in this world. So thank you very much. Thank you all of you. Thank you Dr. Sumit and the team. It's been really grateful. Thank
Just
you.
one thing, I would say that Dr. Gurpreet has never disappointed me. Under the trust, we are doing under the trust, the cost of a surgery at Max Healthcare was 1,80,000. Sir agreed to do it at 1 lakh rupees. So I think big clap for him. He is with me. I always tell him, sir, the family is very cautious about the sterility. Can we do a free single room upgrade? No problem. So I think yes, with cochlear implant, I think he also has the sensitivity which I have. And before we finish this, I must thank one team, the team of audiology from Amplifon. Samit is here, Gaurav is here. I can tell you, we are working with Amplifon the last 14 years. People sometimes ask me, I said, they tell me, sir, you are such an accomplished surgeon, why don't you open your own audiology department? Why don't you set up your own department? You know everybody in the country. I said, if your wife is going strong with you, what's the need of changing it? Same goes for audiology. If they are understanding my requirement, I understand their requirement, we are going headstrong, why do you need to change? If everything is flawless, then let it run flawless. Marriage also runs flawless for maybe 50 years, 70 years till you are alive. So maybe I said, for reality's sake, I am married to Dr. Pooja, but for world's sake, I am married to Max Healthcare and Samit Verma. Amplifon, I would say. So thank you.
Samit, be careful, huh?
So now I would first call some people on the stage. We have cake cutting. So I would first like to invite, of course, all the children should come forward. First of all, my team at Max Sake, SANKALP, for a collage photo with Dr. Gurpreet, and then all the patients come. And I will invite my son, my family too. So my son plays very good Casio. He is going to play something for us. Covid, why don't you come up? So he is 11 years old. He is a fantastic artist. He sketches very well. And he has sketched, and nowadays he has got very good with his piano classes. And my daughter Navya. Navya is in grade 9. She is 13 plus. And Pooja, why don't you come? So everybody, Sandeep, Amrit, Yashu, Samriddhi, Poonam, everybody on board. Sir, cake cutting uske baad mein bas.
एक प्रोजेक्टर बंद कर।
Smile, yeah.
आगे।
Thank you. Can I have all the children above? Please come up for the cake cutting. Rishika, Bhavya, Mishita, come. Kids, come. Please come. Naira, Nitya. Sir, आपको अगले साल बुलाएंगे केक के लिए. Lights on. So we have a special song my son is going to play on Casio. हम होंगे कामयाब एक दिन. So the theme is there that everybody has to work hard, including all of us. Cartoon. आप इसके हकदार हो सर. पहले बैठ जाऊंगा फिर आप जाना. I think everybody can sing also. Thank you everyone for joining, and let's after this we'll have lunch, and please join us for lunch. अभी आ रहे हैं
Hi Kajal, it's Sakshi this side from our factors. Yeah, are you around? So I just wanted to quickly
मूड विद बॉर्डरलाइन ज़्यादा लगता है. दूसरा कैमरा लगा दियो, माइक उठा के दूसरा लगा, माइक उठा के लगा.
लाइव चल रहा है. सुनो ये फोटोज कितनी जल्दी